you're here in Delhi, and perhaps one of the things that doesn't get enough attention as much as it should is the healthcare burden, the healthcare impact on account of climate change, on account of pollution. And are these things that are being taken seriously at a global level? And what do you believe the adequate, appropriate response needs to be?
Yeah, so this is a fantastic question. Here's my view on this. Climate change probably represents the single biggest health threat facing humanity in the years and decades to come. It will change every aspect of health. I don't think that the global health community, and I don't think the global community is taking climate change seriously enough as a health threat. Of course, we're talking about climate change in terms of temperatures and sea levels and all of those. They are important. For me, climate change is going to be seen and felt by most people through health. That's why I often say health is the human face of climate change. Now, what does that actually mean in terms of what should be done? Obviously, we have to work on the underlying causes, carbon pollution, reducing our dependence on carbon and carbon fuels. But the healthcare system has to start, and the public health system has to start thinking about how does it change delivery? How does it manage the fact that we're seeing more heat waves, more pollution? The combination of pollution and heat waves means more asthma, strokes, heart attacks, new diseases. There's a lot of important work that has to be done in the health and public health system that just isn't as far along as it needs to be, largely because I just don't think people have taken climate as a health threat enough. That has to change.
Are you seeing the approach change to that, and what worries you the most? You talked about, the risk of respiratory linked diseases going up on account of climate change, pollution, and so on and so forth. The risk of new diseases as well. What are you seeing at this point in time? What's visible? What does the data tell us already?
Yeah, the thing that data tells us is climate change as a health threat is not something far in the future. It is happening now. We are seeing, whether it's in India or in the US or elsewhere, we are seeing very different weather patterns. We're seeing more, in the US we had wildfires that caused terrible air quality for days and weeks. That has an effect. Of course, we're seeing from climate change drought that's leading to mass migration of people. So these threats that we used to think would be 10 or 20 years down the road, they are here today. And we have got to start working on solving those problems and adapting our systems to climate change today. This is not an agenda of something we need to do a decade from now. We've got to get going.
For more news and updates, all you need to do is follow CNBC TV 18 on all of our digital platforms.